In this video, we will discuss about the mechanism of this Lipo-NC-pGSDMB. In the previous video, we have seen the potent efficacy of this Lipo-NC-pGSDMB. So here, the researchers wanted to see what are the mechanisms that makes their system more potent or have the high anti-tumor efficacies. So here they starts by checking the STING pathways, and at the same time they also check the pyroptosis, and they are able to see that in their system that contains both Lipo-NC and pGSDMB, the activation of the STING pathways is enhanced compared to the system where they only contain Lipo-NC, and they can see that the pGSDMB containing Lipo plus Lipo-NC shows the activation of GSDMB also, so indicating that in their system there is two ways by which this anti-tumor response gets activated. First one is through the STING activation of the STING, enhanced activation of the STING pathways, and at the same time pyroptosis through the activation of this GSDMB. And these things they have later validated through the pro-inflammatory cytokines such as IFN-B, IFN-beta, IL interleukin 1 beta, and IL-18. All these three are upregulated in the Lipo-NC, whereas those are all these things are upregulated in the Lipo-NC compared to the control, and also compared to the Lipo-NC with empty vectors. And these IFN-beta in the serum levels are also quantified, and that also shows the high concentrations in their optimized system. And thereafter they show some immunofluorescence image to confirm this high activations of these STING pathways, and we can see that immunofluorescence is also significantly higher in the Lipo-NC compared to the control, and these things they have quantified in the panel F, and the immunofluorescence images are shown in this panel E. And their idea is that the TME remodeling might occur that cause this Lipo-NC, so their focus is primarily on the different components of the TME. So afterwards they check the dendritic cells, mature dendritic cells, and those markers is CD8 plus and CD86 plus, and they are able to see that mature dendritic cells are high in their system, in their complete system compared to the control cases. And since dendritic cells are high, so there is a possibility that it will cause more priming of the T cells and cause more activated T cells. And these things they have validated with CD8 plus markers, and they can see that CD8 immunofluorescence images are high in their Lipo-NC-pGSDMB compared to the controls. And these things later they have quantified, but that also shows the same things, that Lipo-NC-pGSDMB has more CD8 plus T cells. And since CD8 plus T cells are also high, and the two different ways of anti-tumor response occurs in the Lipo-NC-GSDMB, so they expect the more lytic granules to be secreted from the immune cells or the T cells. And for this they check these granzyme signals, and they can see the granzyme signals are significantly higher for the system or for their conditions compared to the normal conditions. And these things they are quantified in the panel K also. And thereafter once checking the this activated immune cells such as CD activated T cells within the tumors or in the tumor microenvironment, they now also wanted to check what are the effects that happened on the immunosuppressive components. So for that, first they check it on the regulatory T cells, that is FOXP3, CD4 plus and CD3 plus T cells. And they can see that regulatory T cells are also go down, and simultaneously within the tumors they also check this CD8 plus T cells, that is IFN gamma plus CD3 plus and CD8 plus T cells, and they can see that the activated T cells are high in the Lipo-NC within the tumor microenvironment in their Lipo-NC plus pGSDMB conditions. And once validating that within the tumors or in the tumor microenvironment there is upregulations of the activated immune cells, and simultaneously there is a suppression of the immunosuppression components. Now they wanted to check its long-term immune surveillance capability. So they check the splenic lymphocytes for the CD8 plus T cells and CD4 plus T cells, and both of them are high in their optimized condition cases, indicating that there is a activated immune system. There is a activated immune cells are also present in the splenogenic lymphocytes, and it can act on the tumors if they are metastasized to the splenogenic lymphocytes. And thereafter they check the central memory T cells and effector T cells, that is CD44 plus, CD62 plus, and CD3 plus. That is the central memory T cells, and CD44 plus, CD62 plus negative, and CD3 plus is the central memory effector cells. And both of them are high in the splenogenic lymphocytes, indicating the long-term immune surveillance against the bone metastatic tumors for which this Lipo-NC-pGSDMB has been targeted. So this in all together indicates that the mechanisms is that it acts by two different ways. That is through it acts in antitumor response by two different ways. That is first by triggering twisting response, and along with that they also cause the pyroptosis. And the one more interesting thing that they're able to find out that it will generate a long-term immune surveillance against these bone tumors, which is validated by increase in the quantities of increase in the number of central memory T cells and effector memory T cells. So that's all for this video. So if you need to understand more about these mechanisms of this Lipo-NC-pGSDMB in detail, you can go through the reference that has been provided in the description. Thank you for your time.